Your dog or cat has chronic diarrhea. These are my top 7, I think actually top 8 ways to holistically treat this at home. Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets. We're having a brand new webinar. You're invited. Does your dog have a digestive enzyme deficiency? These are the symptoms you need to watch for, and here's what you can do about it. Dog disease is linked to digestive enzyme deficiency, IBD, inflammatory bowel disease, allergies, immune disorders, EPI. Here's what they are, and here's my best natural treatments. You're going to learn everything you need to know about canine digestive health, and best of all, the webinar is free. It's happening Tuesday, November 12th at 5 p.m. Pacific. You can click the link in the box below to sign up. There are multiple different reasons why your dog or cat could have ongoing or chronic diarrhea. Probably the most common veterinary one is called IBD, or inflammatory bowel disease. It shows up as chronic ongoing diarrhea. But what you're seeing at a cell basis, you're seeing all these marked inflammatory cells within the intestinal tract. Some of the common clinical signs you're going to see. First, it's ongoing or chronic. It's been going on for more than 4 weeks. Chronic vomiting, chronic diarrhea. Reduced appetite, weight loss, flatulence, sometimes these rumbly, growly stomachs. In some of our dogs and cats, you have concurrent skin signs in terms of these recurring ear infections, red, inflamed skin. IBD is caused by an abnormal immune response within the intestinal tract. So what's happening is the immune system, it's reacting inappropriately. It could be to some of the bacteria that are within the intestinal tract. It could even be to specific food antigens, i.e. some of the protein in the food. Regardless of the underlying cause, what you're seeing, as you can imagine seeing in the intestinal tract, there's all these inflammatory cells. The intestinal tract is thickened, it's filled with inflammation. Your dog, your cat, they can't digest their food properly. So because of that, you're gonna see potentially the vomiting. You're gonna see this ongoing chronic diarrhea. Your veterinarian is going to start with blood work. They're going to do fecal tests, try to rule out any ongoing chronic parasite like Giardia. They may talk about doing an ultrasound, see if they can see a thickened intestinal tract. The definitive diagnosis, it would come from endoscopy, a scope going down, taking a chunk of the intestine, doing a biopsy, and then they confirm, yeah, there's all those inflammatory cells. Your dog or cat, they have IBD. It's actually surprisingly pretty common. In practice, I saw a lot of animals that had ongoing chronic gastrointestinal upset, i.e. these chronic diarrhea especially, and very few ended up having endoscopies and intestinal biopsies. So here's some steps you should be following. This is kind of the way I would approach a dog or a cat that had chronic diarrhea. Rule some other big things out first. Try the more proven, potentially more effective treatments. And then some of the other specific home remedies. Then in some dogs, some cats, they really respond well to. Number 1, you need to start out with diet. For your dogs, you want them to simple, easy to digest, non-reactive carbohydrate. But for our cats, we're just sticking with that simple protein. We're making like these super simple, basic diets. So a dog example here, veterinary-wise, would be something like this. Here's Royal's Cannon's hydrolyzed protein diet. They've modified a protein to make it far less reactive. Many of the dogs that have IBD, they respond well to this food. That being said, I'm not really crazy about it. The protein they've modified is actually soy. Personal opinion, dogs are not meant to consume. Definitely not cats. I'm going to do a future video discussing these modified or hydrolyzed protein diets, pros and cons of them, and things you may want to think about before you start feeding this to your pet. So you base it on a protein your dog or cat has never had. I.e. turkey, for instance. Very few of our animals have been on a turkey diet. A simple dog one can include 50%, say turkey as a protein, 50% of a simple carbohydrate, i.e. white rice, a little bit of additional fat, i.e. in the form of sunflower oil, and that will be it. And that's something you'd be feeding to your dog for sort of a 6-week trial, being really strict. No other supplements, no other anything. We want to rule all these other factors out first and see if we really modify their diet to a strict hypoallergenic / elimination diet, is that enough to fix their ongoing chronic diarrhea? And for our cats, I say just stick with the protein, the turkey, for instance. Because the first thing we're doing, we're just trying to eliminate some of the other causes, feed something really simple and modified that does not have to be a complete balanced diet. We're just trying to eliminate all the other extraneous ingredients and find out if we modify their diet, does the diarrhea stop? Does the inflammation stop? And if it does, then we can say, okay, here's a pretty good chance, number one, your dog or cat had IBD, primary food sensitivity. At least we know now what we need to focus on. Step number 2, we're going to deworm your dog or cat. Give him something that is a broad spectrum wormer, but in particular can focus on some of those parasites causing chronic diarrhea, i.e. Giardia. And the one I used to use in practice, and I've talked it about a lot specifically as an alternative treatment for cancer, is this Panicure or fenbendazole. And if your veterinarian has done diagnostics, many times it's really difficult to diagnose Giardia just based on the fecal exams. Rule it out. Like, it's just such a good idea, especially in an animal that's had chronic diarrhea. So while you're starting with the new diet, the next part is you're seeing your veterinarian, you're getting the Panicure, and you're ruling it out as well too. You're ruling out that parasite. The standard dog and cat dose is at 50 milligrams per kilo. So if your dog is 22 pounds, as Tula is, divide that by about 2, that gives her at about 10 kilos. 50 times 10, that is 500 milligrams. Her dose is 500 milligrams, and each mil here of the liquid Panicure, it's 100 milligrams. So she needs 5 mils or 1 teaspoon once a day for 3 days. It's real safe, easy medication to give, and it's just a great idea. You're just going to rule out Giardia as the underlying cause. The caveat I have is for cat owners, there's another lesser known intestinal parasite called Trichomonas fetus. Fortunately, it doesn't respond to fenbendazole. In that case, you need to have your veterinarian prescribe another med specifically for Trichomonas. Number 3, a good quality multi-strain probiotic supplement for dogs and cats. I want you to get on a veterinary specific probiotic supplement that is shown to have the specific bacteria that are beneficial for our dogs and cats' intestinal tract. So in many of the cases, what's happened is there's been, say, some type of GI upset, i.e. from a food reaction. Some of the wrong bacteria have colonized your dog or cat's intestinal tract. The whole intestinal balance is upset. So you need to get on a good quality probiotic supplement, but one that has high enough levels or high CFU levels so it can adequately colonize the tract. You want to ensure that there's multiple strains within the supplement. You also want to ensure that it's in a capsule formation, doesn't get broken down in the stomach, can make its way into the intestinal tract and colonize the tract. One good option is ours, Dr. Jones's Ultimate Probiotic Formula for dogs and cats. In high CFUs at 5 billion CFUs per capsule. You're going to give 1 capsule per 50 pounds of body weight daily. You're going to do that for 30 days. And then by that period of time, if it's probiotic responsive, you should start to be seeing a result. Number 4, that wonderful anti-inflammatory gut-soothing herb. None other than this here, slippery elm. Slippery elm comes from the inner bark of the slippery elm tree. It's been well documented to be very safe and very beneficial for many of our animals that have IBD. Virtually no side effects. It's safe for all the organs. It'll go down inside, it'll coat the intestinal tract, and it'll soothe it. It can naturally decrease all that inflammation. And it's just amazing to see how many animals respond so well to it. Each capsule, it's about 400 milligrams. Standard dose is 400 milligrams per 10 to 20 pounds of body weight once or twice daily. When there's an initial big flare-up, you're going to use a fair amount. One thing I suggest is either opening the capsule up, sprinkling that onto your dog or cat's food, and or getting the powdered form. Here I've already got it pre-ground. Each capsule, it's about 1/8 of a teaspoon. Right, so you can think of that, about 1/8 of a teaspoon per 10 to 20 pounds of body weight. I'd be doing that twice a day. If you have a dog or cat with chronic ongoing diarrhea, you've never tried slippery elm, give it a try. I mean, I just found it works so well. Number 5, a vitamin B supplement. Shown to be helpful for many cases of IBD. This one here, vitamin B12. B12, I more think about it as a brain supplement in terms of helping normal neuron function. It's one of the big, and that's why it's called here. It says brain B12. But it also turns out that B12 is critical for normal intestinal tract function, and in particular, helping the intestinal cells heal themselves. So what they've seen in many cases, many of these animals, you give supplemental B12, many of their clinical signs resolve. So for many of the dogs in practice, we give it, but it was via an injection, a sub-Q injection under the skin, and your veterinarian can teach you how to do this at home. But another option is to start and try the oral capsules or the oral little tablets like these guys here. These are 1,000 micrograms, pretty typical dose, about 1/4 of one of these tablets per 25 pounds of body weight once daily. Number 6, it's considered the natural corticosteroid. None other than this, Licorice root extract. Licorice root, it's been extensively used in Chinese medicine for thousands of years. So important that it's considered one of the key herbs in most Chinese medicinal formulas. They include licorice root. Licorice root is in particular benefit for intestinal disorders. It's being used for acid reflux and heartburn. It's being used for IBD, inflammatory bowel disease. We know that it's a potent anti-inflammatory. And for instance, the traditional treatment for IBD, where I had many dogs go home on prednisone, the only thing they seem to respond to is we'd suppress intestinal inflammation via steroids, sometimes even a stronger drug like azathioprine. But the big benefit of something like licorice root, we're not suppressing the rest of the immune response. We're just suppressing what's going on within the intestinal tract. But because it's one of the more important herbal tinctures, the active ingredient within licorice root, glycerin, put more strain on the liver, may put more strain on the kidney. So because of that, I always suggest that we're not going to give it long-term, day after day. The maximum we do is give it for 14 days in a row, give your dog or cat 7 days off of it, then we start on it again. That being said, there are thousands of animals that have been treated with licorice root, with no side effects. They've responded really well. But for the sake of caution, that's why I suggest maximum 14 days in a row. Number 7, another specific anti-inflammatory, and I've seen a bunch of animals respond to it. The non-psychoactive cannabinoid we all talk a lot about, CBD or cannabidiol. So when we think about IBD, we're thinking about this overactive immune system. It's like decided to target some part of the intestinal tract, causing all this inflammation, leading to the chronic gastrointestinal upset. CBD, it can help modify that. It can block all that acute inflammation. And for many animals, it actually seems to make a really big difference. They have less gut inflammation, leading to less chronic diarrhea. Our dogs and cats, they tolerate CBD really well. It's non-psychoactive, really easy to give, and it's a great option. If you've got a dog or cat with chronic diarrhea, if you've yet to try CBD, you should be thinking about it. A standard CBD dose, 3 milligrams per 10 pounds of body weight. I'd be giving that twice daily. I do for 30 days and then assess, is this helping my dog or cat or not? Let's proceed, number 8. This is the anti-inflammatory herb that we talk a lot about for pain and inflammation. This here, the 95% curcumin. The 95% curcumin, it's the active ingredient isolated from turmeric. I've talked about it in a variety of different situations, more specifically for pain and inflammation, some of the chronic inflammatory disorders, i.e. dry eye, even like cognitive dysfunction. It's also been studied and looked at for inflammatory bowel disease, some of the other inflammatory intestinal tract disorders. Results, in truth, have been mixed, but there has been some positive results. So it is a good option to consider. If you've tried a whole bunch of other things for your pet and nothing else has worked, then you want to be thinking about the 95% curcumin. I'd look at the standard dose of 250 milligrams per 50 pounds of body weight daily. Then number 9, holy cow, it's a lot of remedies today. Gonna something like these. These are digestive enzymes. For many of our dogs and cats that have chronic diarrhea, yes, very well, it could be inflammatory bowel disease, but there also could be something that's not allowing them to then break their food down in the first place, so then it can't get absorbed, and or it stays in certain parts, making it especially reactive, causing the inflammation. What some pet parents have seen is if they supplement their dog or cat with additional digestive enzymes, the food can then properly get broken down, and then they're seeing some of those chronic GI issues resolve. There are a number of specific digestive enzyme supplements out there. A good one, especially for a dog or cat that has ongoing chronic diarrhea, i.e. inflammatory bowel disease, one like this. Our Digestive Care Soft Chews, they include specific digestive enzymes designed for dogs. The digestive enzymes, amylase, lipase, protease, lactase, even the anti-inflammatory bromelain, as well as probiotics to help the intestinal tract. If you have a dog or cat that has chronic diarrhea, ensure you go through those steps we first talked about. Doing a proper food trial, deworming your dog or cat, like ruling out Giardia, for instance, as an underlying cause. Trying some of those remedies I discussed, you may actually be finding you're going to get a positive result. And lastly, I really encourage you to sign up for our brand new webinar. Does your dog have a digestive enzyme deficiency? The many chronic dog health conditions linked to digestive enzyme disorders. Chronic vomiting, chronic diarrhea, allergies, EPI, inflammatory bowel disease, immune disorders. I'm going to show you my top natural remedies for all those specific conditions. And you're going to learn why this could be happening to your dog, and then more importantly, exactly what you can do about it. The webinar is free. I encourage you to come. It's happening Tuesday, October 12th at 5 p.m. Pacific. You can click the link in the box below to sign up. Click up there to subscribe, hit the bell to sign up for notifications, and when you click that link directly in the box below, I can send you a copy of my free book.